Hey, I just wanted to give an update. I have a problem with my TMJ. It's getting a lot worse on the left side, and very easily like pops out and tears, and a little bit on my right. And it's like I can't really open my mouth much wider than this without it popping out. And also, like 2 days ago, I woke up on I was laying on my left side, like with this side, and and everything was like reverberating, all the sound. Like when I hear sounds, I hear like a solid tone of the sound that any sound I hear in my left ear, like a blip. It sounds like the teacher from like Charlie Brown. It sounds like that. Anytime I hear sounds, I hear like wah 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 wah, like in my ear, and things are louder on my left ear. I assume it's something to do with my eustachian tubes, because they can be involved with hearing, like if they get clogged or if you can't equalize pressure. You get the same kind of sensation when you go up in a plane, and then your ear feels like full and like things sound different, and it's like that in my left ear. And of course, I look up. All right, let me see this TMJ doctor. Maybe I can get one fucking thing fixed that's wrong with me. And I look up TMJ doctors and call them, and they're like, yeah, we don't take insurance. It's like, motherfucker, like, I swear, I just feel like my purpose in life, my entire life, has been to make rich people richer. And now that I no longer can work, I should just go away and die, because I can't make money to make the rich people richer anymore. So that's like what our system is in place. Like, I could be fixed. I could just be fixed. But that would make the rich people poorer to make me fixed. Which is still stupid, because in the long run, I'd still make them even more money through, more medical procedures, more taxes. But I just fucking hate this country. And it's not to say other countries are amazing, right? Like Canada and England, like they sound nice, but their healthcare systems suck ass too. Um, so I don't know. I mean, it just seems like if you don't have money, you're fucked. I don't have money, and I don't know. Disability. I have a hearing on the 7th of December, and if they approve me, then I'll have a little bit of money, and maybe I can get surgery on my jaw to fix that, and have one fucking thing fixed. And then get my eye fixed too. My right eye is like I'm seeing like this fucking floater. Just one floater, but it's always in my vision. Get that fixed too. And God, my neck. I've been walking around a little bit more without a collar. Part of the reason is because collars just fucked up my jaw. Like wearing collars all the time. Because when the collar is tight in your neck and doing its job, your mouth's like this, and when you you're pushing down here, which puts upward pressure here on your jaw, which over time, again and again and again and again for months, I guess mess with the disc. I've seen a lot of people I talk to a lot of people who wear collars, and their their jaws are all fucked up, especially hard collars. So I've been trying to go without it, and I've been um, but I've been tracking my steps. Generally, I try to make sure that I keep to about the same amount of steps every day, so that I'm not overdoing it with like stuff, like walking around and whatever. And then if my neck feels a little extra tired, I'm like, okay, I'm just gonna rest. I'm not gonna try and push through it. The same what happened to me before is I push a little bit, and then it just gets worse, a lot worse. So But God, I just feel so hopeless every day, and the TMJ thing, and it's like, I don't know. I don't know what I'm gonna do. Like, if I was supposed to get a test for Lyme today, I went in. It was hard for me to travel. Got in the back of the car. Got driven down to get the Lyme blood work for the place up in Serenity Healthcare up in Wisconsin, because they actually test for everything, like all the strains of like Borrelia and Babesia and Bartonella, and there's like 20 different things in the list they test for. And whereas like, and instead of like the typical Western blot test, and they also gave me like the two tinctures of like one was cat's claw and the other was something else, and you take them every day for like 6 weeks, and then you get the blood test, and then you figure out if you got Lyme. And if Lyme, I don't know if Lyme is causing this, so because like I remember when I was a kid, like having joint problems that other kids didn't have. But I don't know. I mean, I also like played hard. I played a lot of sports. I was very physical, so like maybe I got more injuries because I was more active. Um, I don't know. I mean, I don't know anybody else my age with Dupuytren's contractions, and I got 5. I don't know anyone else my age with the knee problems I got. Um, I mean, my knees aren't so bad anymore because of rehab, but and obviously people can get knee injuries. It could be worse than me, or maybe they played like football and their knees are shot. I don't know, but like uh, hip issues that I had, elbow issues that I had, hand issues, like the backs of my hands hurt, like in between the grooves of my fingers, like in on the back of my hand. I can't really point to it. Like they hurt, so I've been doing like one of those like grippy balls, because that strengthens like your hand. That seems to be helping. It just seems to be any place that I'm not continually like rehabbing is just like falls the fuck apart, like real bad. But I know people that, like, I do more stuff with my shoulders and my hands than fully capable people do, and I have to, because otherwise my shit just falls apart. But I don't know. I'm kind of hoping that I have Lyme. I'm kind of not. If I have it, then maybe it could be treated. Maybe there's some hope. I'm supposed to go to Ohio on the 7th. On the 4th, I'm supposed to go to Total Spine. I imagine they're gonna. I'm like, why do I have to go there for him to review my MRIs? Because I had an MRI when I was in the hospital, which was useless because it wasn't even upright. So it was a prone 1.5T MRI with 3mm slices, which is fucking stupid. Um, but what do I know? I'm just a patient. I can't know anything. And the guy I was talking with, the tech who was doing the MRI, didn't even know that upright MRIs were a thing. I was like, yeah, they exist. And 5T MRIs and 7T, they even have like 9Ts they're working on. I'm using a 1.5T prone, 3mm slices. Like, I was not going to see shit. And I'm supposed to come in back to Melbourne, a 40-minute trip in the back of a car to go in to have him do a review of my MRI with me. I'm like, okay, I'll review it. It didn't show shit. There. So can we move on, please? But I have to come in for him to say that. And then on top of it, he's like, he wants to do a physical exam. I'm like, where was the physical exam when I first fucking came to see you? Like, Jesus Christ. I went to see the guy and didn't touch me, didn't look at me, didn't talk to me. Then when I was in the hospital, came to the hospital, didn't touch me, didn't look at me, didn't touch, like, didn't, ask me to move or do anything. Just basically ignored me. Said like 2 words, like, how you doing? I was like, pretty fucking rough. And he's like, okay, well, just gonna get some imaging and we'll see you later. I'm like, All right, way to like put some effort into your job. Like, what the fuck, dude? Like, god damn. I mean, I phoned it in at work sometimes, but god damn. So, yeah, and then, so I'm probably gonna go ahead. I'm probably gonna fuck around and be like, I don't know, go to, like Mayo Clinic. I'm gonna be like, yeah, they don't take my insurance. And he's gonna be like, oh, I don't know, you'll have to find someone. I'm like, oh yeah, I'll have to find someone neurosurgeon who can't figure out the problem. Why don't you find someone? And I think that's about how it's gonna go. Because they're all, bare minimum. What's the least I can do? And I'm gonna go to Columbus. I'm gonna go to Orlando to fly to Columbus on the 7th. My dad's gonna pick me up. I'm gonna stay in a basement, and it's gonna be a cold basement in the winter in Ohio, and I'm sharing it with my dad, which is not the end of the world because I can be like, hey, can you help? Can you get me a drink? Can you help me with this? Because so many times I'm like, man, I really need to rest. I really need to rest, but I really gotta piss, or I really gotta get up and get a drink, or I really gotta get some food, or I really need to get up and do something like call someone. It's like, and I have to do it. I can't rest. I mean, who knows? I might be like mostly cured by this point if I didn't have to do all that shit. Um, and he's got a bed that like is adjustable, which was a godsend at the hospital. Even if I could raise this bed like 10, 15 degrees, just take the pressure off my head and my neck. So, that would be amazing. So he's got one of those too. So I don't know. He's gonna take me down to Cincinnati on the 9th. Go see Dr. Virojanapa, and what's gonna happen there is we're gonna go see him, and he's gonna say, "Yeah, your imaging sucks. We're gonna order new imaging." And of course, he can't do that. God, it's so weird with that humming when every time I say a word. But he can't. Oh my god. It's like having someone repeat back what I'm saying to me while I'm saying it. So fucking weird how that even happens. Um, God, it's hell. I mean, as if I wasn't already suicidally depressed enough. Like, I swear to God, if euthanasia was illegal, I would be there in a second. I'd be like, all right. I would be fucking excited. I'd be stoked. I get to fucking die, and I get to fucking die with some fucking dignity. I don't think it was fucking doctors anymore. It'd be fucking amazing. But no, I'm left to my own devices, and I don't trust myself to end my own life. I'm like, all I can think of is like, okay, I'm gonna do this, and I'm gonna fuck it up, and then I'm gonna suffer for another 20 years, even worse. It's like, uh. So anyway, so going to see Dr. Virojanapa on our fun trip to Cincinnati, and he's gonna say, yeah, so this imaging you have is no good. I don't see any problems. We have to order new imaging. And of course, he can't do that like before I go see him, right? He can't do that. Even though that's what's gonna happen. He can't do that. It's like, I don't know, insurance bullshit or something. So I think it's the voice vibrating up through my jaw and being distorted by something. Anyway, I wonder if it happens when I hold my jaw. Uh, so yeah, so like I um gotta do that, and then come back, and then do the imaging, and drive back down, bring the discs, because people don't know that mail exists, and you can mail discs, so I have to bring them myself. And then yeah, I'm gonna go down there, and he's gonna look at the imaging and be like, yeah, I don't really see the problem. And it's time to go fuck myself. And I'm gonna be left to my own devices. I mean, uh, yeah, I can feel the vibration right here. When I hear the humming, I feel it right at the joint. So if I talk loud enough, it's just Um, fuck. So gonna do that. It's crazy how like all these doctors, these neurosurgeons, be like, oh, I don't know if you have CCI. I don't know if you've got this. I'm like, I literally go to regenexx. They take blood out of me. They spin it up. They inject it into my ligaments. While they inject it in my ligaments, they're like, holy shit, your ligaments are damaged as fuck. Were you in a car crash? I'm like, no. And then they inject me. And then all of my symptoms of instability improve. All of them. Every time. PRP regenexx, PICL regenexx, like help. So literally fixing the ligaments is fixing the fucking problem. And they're like, gee, I wonder if the ligaments are the problem. I'm like, what? Wait, I just told you not a minute ago that I went to regenexx and it helped. And they're like, yeah, I don't know if it's your ligaments though. It's like, bro, like, how are you that dumb? Like, I would have to drink like 10 fucking beers in a row and I'd still be smarter than that. Baby. God damn, that's fucking stupid. Dr. Bolognese is fucking going senile, telling people. I'm not the only one. He's telling multiple people with like clear CCI, and he's just like, yeah, you don't have CCI. It's like, yeah, like they fucking do. You fucking idiot. Like I'm watching Dr. Bolognese's old videos he recorded like 10 years ago or whatever about how to identify CCI, and I'm mashing them up with patients who have CCI, and then he's going against his own criteria and be like, yeah, they don't have CCI. I'm like, and then these people go get stem cells and PRP, and then they get better. And it's like, oh, they didn't have CCI, but fixing the CCI made them better. Huh? Who would have thought? So I just, what bothers me is like that this shit should just be covered by insurance, right? It should just be, you know, like, because if regenerative medicine was covered by insurance, I wouldn't deal with any of this. I just keep doing it. I'd be like, all right, well, maybe I need more regenerative medicine because my connective tissue is weaker. And I would just get it. I need more on my spine, get more on my spine. And maybe I'd need more through my life and other people. And so be it. But it's not covered. So all of this, because regenerative medicine's not covered. My jaw, the tinnitus, like all of it. I live a life worse than death because regenerative medicine's not covered by insurance. Um, so that's fun. And so that bothers me. But then also what bothers me is the extreme stupidity of the doctors. Like, I'll tell doctors, they're like, oh, I can't see your ligaments on the MRI. I'm like, well, there's this guy, Dr. Rosa, this chiropractor, expert in MRIs. You could, like, call him and ask, how the fuck do I do my job? And then he would say, oh, here's the fuck how you do your job. And then he'd tell you. And he could show you, he could teach you, you could be like, look, I need to know, your methods. Even if you get, I'll share the profits with you. Every time I image people, every time I image a patient using, I don't care. I'll share the profits with you. That's money, whatever it takes. But we got to figure out how to help these patients, and they just don't do it. So I don't know. I mean, my ligaments have never shown up on a MRI. A lot of people's ligaments have never shown anything on MRI. They don't see any problems. And the thing too is like structurally, like everything is perfect. Like my brainstem doesn't really have much compression. I feel like my C1 squishing against it. Like if I tuck my head, I get hot flashes, and if I, if I, pick my head up, like hold it for a second when I'm laying down, like my brainstem will get squashed by bone, and then I'll have tinnitus in my ear, and then it's awful. I mean, although that could be ligament stretching too. I don't know. It's pretty fucking intense tinnitus when it happens, and so like, and then the arteries are good, the vertebrae are good. C1's obviously twisted. That's not good. Loss of cervical curve, not good. But like it's not extreme loss of cervical curve. It's not it's like 10 degrees rotation. It's not the most extreme. And my discs are good, and my my spinal cord is good, and all their measurements, even though like upright MRI measurements aren't that bad. But it's like God help me if I try to walk, man. I just my head's going this way and that way, and I don't know. I just can't fucking hold the thing up. Some of it's muscle issues, but like some of it's like I can't hold it up. Like I'm using my muscle to hold my head up. And when I let go of that muscle, my head is just whoa. It's just like not being held up. Like it just it is bad. Like I start getting pain real quick if I'm not like really using the muscles to like hold my head up. But the thing is when you do that, like go ahead and like walk a mile and like try to stand as tall as possible while you're walking. Like perfect posture. Nothing with your shoulders, nothing with any part of your body. The only thing is just focus on keeping the top of your head as close to the sky as possible, which is generally puts your body in perfect posture for you. So it's not about whether it's forward, whether it's backward, whether your shoulders are backward or forward, just top of your head is high. And just try to keep your head in that position and walk a mile. Like it gets tiring. It gets real tiring to hold your head like that. And I have to do that because otherwise when I do that, most of the pressure's off my ligaments because it's the muscles doing all the work, muscles and tendons. And but then when I'm not doing that, it's like my ligaments are just like, fuck it, I'm not doing shit. So that's why I really, if I had a craniocervical fusion, I would just hold shit up, and then I could like walk like a normal fucking person. Like as much as I use my neck muscles never get sore, right? Like if I lift weights with my arms doing like I'll lay in bed and do like, presses like this with like a 5 pound weight. Because 5 pound weights I could do in bed a bunch and they don't like aggravate my neck and keep my chest strong, shoulders strong, triceps, biceps, etc. Not super strong, but like keeps them from atrophying and nothing, takes care of my joints. But those muscles get sore. My neck gets tired and like, and if I get to the point where I need to like push through it, like exert myself, which would make the muscle sore, then I'm damaging the ligaments. I can't do that. So I'm always stopping. Like, so my neck never gets sore because I have to stop as soon as it gets a little tired. So my neck is taking a lot longer. Getting my neck stronger has helped. Like when I get out of bed, I'll get on the right side of my bed and I get up that way, and that strengthens this side of my neck, and I get up this way and it strengthens that side of my neck. So like this side of my neck's weaker. So when I like push this way, it feels kind of sketchy. When I push this way, I feel like I could. It feels like tough. Like this side's like tough. Like I could really keep things stable. So the strength of my neck is like it's a factor. It's definitely a factor in keeping my head up. If my neck was like 5 times as strong, then I imagine like the ligament issues would be less of an issue. But it's also like, how do I strengthen my neck without fucking hurting my neck? And it's just like I just do what I can do I try to do a little more each day, but it's like I can't like when I'm walking around, like I try to just you know just be careful and do what I gotta do to get through the day. And I'm on about like 1,400 steps a day, which isn't much. Like if you get up and go to the bathroom, get up and go make yourself food, and like maybe go get the mail and go get a shower, and you just do those things, that's it. I mean, you're at 1,400 steps at the end of the day. So I'm doing like the bare minimum. I do isolation exercises, like where you hold your head still and you push against it, push here, like push up, push forward. And so like I'm not moving my neck. I'm just, and same if I'm doing like pec flies, going like that, like I'm stabilizing my head. Because if I go like this, like my head wants to roll, so I'll just hold it hold my head still. So I'm not really, it's only a 5 pound weight. It didn't seem to aggravate my neck at all. I've done it, been doing it for a while now. Um, and yeah, so it's hard, yeah, because it's like I can't, like, if I do anything new with my neck, if I do like one chin tuck, I'll do like that. I'll do like one, and then like let me see how I feel tomorrow. Like, cause it's just like it's just so the ligaments are so fragile. Like the muscles are ready to go. They want to get strong. They want to be do stuff. The ligaments are just not fucking there, and I can't get a surgeon to like take me fucking seriously. I can't get them to do like help me. So I mean, honestly, I don't even know if surgery is going to be good. I mean, the way my connective tissue is, I mean, I guess say I get a craniocervical fusion, and now I got all this weight, like I'm bending at C2, C3 every time I lean forward. Um, that scares the shit out of me. Like, it really worries me. I feel like I'm still gonna be in the same boat for like 6 more months. If I get surgery, I'm still gonna be like, okay, I still have to be real careful because I need to still build up the strength of my neck because I still can't be relying on like I gotta be able to keep my head straight and not be like bending at C2 and C3 to like look down and shit like that and like hurt that disc and pull on those because there's I don't know what you call them, tendons that go from your C2 to your C3 on the transverse, the whole wing of the transverse process. There's like a web of tissue. That's why like if you take your finger and you feel where your C2 transverse process is, you feel your C3 is, you try to push in between it, like you can't because there's a web of tissue in the way. Otherwise you'd be able to push right through, but you can't. There's that connective tissue in the way, and that stuff I'm like, is that just gonna like tear? Is that gonna rip too? Like, and then what? Then if that's unstable enough to get like C2 C3 fused, and I mean you hear about people having to do that like down the line, like 10 years down the line, because you do a little more wear and tear on C2 C3. But I'm not like other people. Like I'm this wasn't from a car crash. This is like I've got a systemic problem. This is like every tendon and every ligament in my body is affected. Like my toes are affected, my hips are affected. Tendons aren't so much of a problem because like I work out and tendons grow. So it's like I fix it. So that's not an issue. And they grow fast. Like when I lift weights, my muscle grows real fast. Like I think I gained like 15 pounds in the summer, just lifting weights, just boom. So like in 2.5 months, uh, gained 15 pounds, and it was just like that's nothing. Like I really gained muscle fast, and my dad's huge. His muscles also grow quite quickly, and he's massively strong when he works out. And he kind of hasn't worked out that much, but my connective tissue sucks assholes. Like so, my ligaments are like, yeah, but I don't feel like doing shit. I'm not gonna. So, and I can't afford it. If I could just get regenerative therapy, then it'd be like, okay, just my ligaments in my spine, my wrist, my ACL, whatever, just inject it up, and I'll take care of the tendons through exercise, and we won't have a problem. But I can't do that, so I just lay in my bed all day and pray for death. I mean, at this point, I don't care. People, they tell me like, oh, hang in there. It's like I don't want to hang in there. Like for what? Like, what am I going to accomplish now in my life? I mean, the odds of me getting better to the point where I can just live normally. I mean, maybe if this was Lyme, and maybe if I could cure it, get rid of it, manage it, and then I don't have any more problems, and I can get a craniocervical fusion, and then get to the point where I can get back in the gym and just strengthen the rest of my body, and just be strong again. Um, but that's something like that's like a 2-year process. Still wouldn't be able to work. you know, and then I'm 42, and then I don't know. I'm already 80,000. I'm still $80,000 in debt from school, and 90 maybe. I'll never be able to buy a house. Um, and as it is now, I can't use a computer because I have like vertigo. If I look at a screen, it's horrible. Maybe that'll go away. You know, it's just so many fucking hurdles to just live fucking normally. But I'm just like, dude, I'm good. I got to pet dogs and cats and birds. And, you know, I had some wonderful pets in my life. And I got to work some interesting jobs. And, you know, women sucked. They Dating women was pretty awful. It was just them telling me, you know, I'm not good enough. And never being satisfied. Even though I'm like, you know, a straight A student, make a lot of money. Um, um, I don't know. I think I don't know. Maybe I just suck in relationships. But I get the dogs and the cats though, and the birds, and some reptiles, some turtles, some squirrels. You know, the animals. I got to pet them. I got to play sports. I'm good. I'm fine leaving this world, right? Like I see what my 92-year-old grandfather's going through. My 91-year-old grandmother. My other like 90-year-old grandmother. Like I'm cool. I don't need to live like that. Life's overrated, you know. So I don't know. I mean, if I could be healthy again, you know, just but I don't know. I just don't. I don't care anymore. After 3 years of this shit, and things keep getting worse, things are breaking down faster than I can fix them. Nothing's fucking covered by insurance. All the rich people just want me to fucking die. Even my own family doesn't want me living here because I'm too much of a burden. Even though I don't, I literally, I was in my room all day today. Nobody helped me with anything. Well, that's not true. My grandmother, I asked her to take me someplace real close. But, you know, 99 days out of 100, I'm not asking her to do that. And I'm just doing everything myself. Literally everything. Cooking, cleaning, taking the garbage out, getting the mail. You know, how am I don't do shit. I mean, they don't do shit for me. Except throw some money at me and then make me do things that hurt my neck again and then bitch at me about it. It's just like, oh, my family. If there's one word I had to pick that I hate in my life, my least favorite word is family. Because family, those are the people that are gonna fuck you. Like random people on the internet, random my friends, random people in the community have been way more gracious and way more helpful to me than any of my family ever have. It's ridiculous. Like it's just ridiculous. So I don't know. I think my family have just seen me in my life as just here's this person I can hurt so I can feel better, and they have to take it because they're family, you know. And then on top of that, everyone tells me, "Oh, but they love you." I'm like, they don't. And, you know, I know they don't because my brother died, and none of my family gave a fuck. Like none of them did, and he was the lovable one. He had a personality. I'm kind of more of a stick in the mud than he was. Like he was, you know, he was special. Yeah, it was good knowing him. But and they didn't give a fuck about him. So then people tell me, oh, they care about you. I'm pretty sure they don't. So, like, yeah. Anyways, that's what's going on with me and my fucked up life. Hope your fucked up life isn't as fucked up as mine.